Today we're going to look at class and health. Now, this is part of my social inequalities and health inequalities series, and it'll follow on from my first introductory video that I did a few months ago. So today we're going to specifically look at class and health. Now, the main points we're going to think about today are thinking about class and health and how that relates to mortality and morbidity. And I'll define those in a little bit. And we're going to analyse explanations for some of these class inequalities as well. Again, these videos are meant to be a recap, and obviously, I encourage you to do further reading. All of my statistics are from ONS, Office for National Statistics, unless I specify otherwise. All right then, so we can look at health in health and social inequalities in many different ways. But a good place to start is looking at class. Now, I'm thinking of the British or the United Kingdom class system. The American class system is different. So we're thinking of the traditional British class system and how that is divided up. And also that is quite complex in itself because there's lots of ways that class can be divided. Now, in social sciences and in sociology, we talk about social stratification. So stratification, we borrow that term from geology, as in rock stratification, but we're thinking of layers of society. So we talk about social stratification. And in most societies, or probably all societies, there is some form of social stratification, no matter how basic or complex that is. And actually what we find is, in the more affluent countries, affluent meaning wealthy, we find that there is a bigger gap between rich and poor. Now, when we're thinking of social class, there's lots of ways that we could measure class. And as I said, it's very complex. In the United Kingdom and in Britain traditionally, there was the upper class, the middle class and the working class, and the underclass as well. Now, the upper class would really, or is, kind of royalty, landed gentry, those born into money, historically, that have money. The middle classes, we can get into dividing up middle classes into subsections as well, but for the purpose of this short video, we'll just say middle class. So middle class are usually earn good money, professionals who earn a good income, own their own home, markers like this we can use. And then the traditional working class are maybe people who don't necessarily own their own home. They might do more sort of routine occupations, things like that. And then the underclass would be is a different kind of category of people, and the underclass is potentially people who are long-term unemployed and involved in long-term crime and that kinds of thing. Okay, so that's the kind of traditional way we would think of class. Now, in the UK, the British government now use an 8-class system when they are looking at social class. And this is called the NSSEC. You should be seeing these now. But essentially, this is an 8-class system, the NSSEC, and this is not actually about traditional social class. This is a way of dividing people through socioeconomic status rather than sort of the traditional class system. So at the very bottom there, 8 would be never worked. At the very top, it would be kind of higher managerial, and there's kind of lots of rungs in between. But this one kind of is based on really social status and how qualified you need to be for that role, things like that. It's not necessarily about money, although that does play a part. Okay, so that's a little bit about kind of the general class system. We could probably do a whole video just on what is social class, but I'm trying to link this to health. So the sort of lower in the social stratification you are, the more likely you are to have ill health lower life expectancy. And we're going to try and explain some of the reasons for that. So I said I'd mention morbidity and mortality. Morbidity is illness rates, so rates of illness. Mortality are death rates, okay? Now there's exact parameters for that, but for the time being, let's just say mortality is death rates, morbidity is rates of illness, okay? Now, to highlight this class and health divide, I'm going to put a graph up on the screen now from ONS. Now, this graph is the same as the NSSEC classification system that I showed you, but now what they've done is they've divided it into men and women for each of those classifications, and they've also looked at death rates. Okay, so this isn't life expectancy, this is the rates of death. So as you can see, the higher up you get, the less likely you are to die, essentially, and the lower down you are, the more likely you are to die. But we will do a video on gender separately, but you can see there that actually women actually fare quite well throughout, no matter what class they're in, whereas men, the lower social class, the less unskilled the work, the more unskilled the work, the lower the life expectancy, so the higher the death rates are for men. So there's a real issue there. You might be wondering why this is. There's lots of reasons as to why this might be, but particularly for men, some of the key reasons, the more unskilled a job is, the less stable it is in terms of consistent income. Now, consistent income can have an impact on things like what food you can buy, activities that you can do, gym memberships, not being able to do things like this. Whereas if you're in a stable middle class job, you would have more disposable income to do these. You could make better choices about food and recreational activities. Also, with the lower working class males, there's more risk behaviours. Now, men across the board take more risky behaviours, no matter what social class, but this is more prevalent in the working classes. So in sociology and social sciences, risk behaviours are behaviours such as smoking, drinking alcohol, drug use, dangerous driving, taking general risks. Okay, now women do perform risk behaviours, but actually men are more likely to engage in risky behaviours, and this can actually lead to shortened life expectancy. Now that's a point I haven't made actually, and I will address this more in the gender video. However, what the trend basically is between men and women, that women live longer than men, men die younger than women. However, women suffer with more ill health throughout their lives. Okay, but we'll address that in another video. Other reasons for ill health: men tend to not visit the doctor until something is very serious. So it tends to be that maybe something's too escalated to deal with, whereas if they'd have gone earlier, they could have been treated for an illness. Again, if a man is doing a kind of unskilled job on an unstable contract, it may be very hard for them to leave and go to a GP appointment. GP surgeries tend to be 9 to 5, some are a bit longer. And because of this, men can't actually get out necessarily to go to an appointment, and if they do, they may lose pay, and again, that is a cycle. So they're losing pay, again, the choices they can't make, they're making bad choices on food, exercise, diet, things like that. Now, I just wanted to highlight another sort of case study. Now, I've said most things are from most data is from the ONS. This piece of data that you're going to see now is actually from the World Health Organization, 2008. And this was a study that was done in Glasgow, and it culminated in something called the Glasgow Effect, where they looked at males in Glasgow and actually looked at their life expectancy based on location. And what they actually found was that there was a gulf in life expectancy, even in areas that are geographically close. So areas of Glasgow that were very close to each other one affluent, one less affluent. Those that were in the less affluent areas of Glasgow, males had an average age of 54, whereas if they were in a more affluent area, their average age was 82. Now they actually then compared this to other parts of the world, and the poorer area, or the less affluent area of Glasgow, actually ranked below India, the Philippines, Lithuania, Poland, Mexico, in terms of life expectancy for men, which is really shocking. And the United Kingdom is one of the only places that there's such a wide gulf within health, differences in health and class. So I hope this has kind of set the scene a little bit for class and health. As I said, keep an eye out, because I'm going to be doing a whole series of this. We're going to look at things like gender. We may address more issues around class. Certainly when we look at gender, that'll come up again. We're going to look at disability, race, ethnicity. Thank you very much for tuning in, and please feel free to subscribe and give the video a like if you've enjoyed it, and leave a comment for me if you have any other ideas of future videos you'd like to see.